building, we have split levels of our departments. Again, this is the OBGYN area. I think a total of 12 or 16 exam rooms that we have for the OBGYN center. This is where our nurses and providers, will come in and do the testing that they need to do from our patients. And right now where we are is we're actually at the prescription assistance program. And Donna Barwick is our coordinator here. Donna? She is our coordinator for this program.
In our program, we help patients that don't have any insurance to receive some of their prescription medications for free through our program. And once they're approved for a year at a time, and they get a 3-month supply of medication. And I'm here to help anybody that's uninsured that needs to help get some medication.
This can be for underinsured as well. It could be someone who has Medicare but does not have Medicare Part D. It could be an insured person, but they don't have prescription coverage adequate enough to cover their medicines for their chronic diseases. This is our dental department, and we have 8 exam rooms right now. We have 5 dentists that are on site, and we do have dental hygienists as well. One of the pluses or one of the bonuses for our department is that all of our providers, all of our dentists are bilingual.
Hello, I'm Dr. LASHAWN Weaver-Lee. I am the Chief Medical Officer here at Kinston Community Health Center, and I'm also an obstetrician and gynecologist. So the best part of being a provider is the patient population that we serve. We serve an underserved patient population. We serve patients who really need our help, and I think that's the best and the biggest difference for me between working at the health center and being in private practice, is that the patients seem to be very, very appreciative of what you do for them here, and so I have thoroughly enjoyed working with this patient population.
I've really enjoyed working here so far, and have enjoyed being able to help this local population and seeing what resources that have been available to LENOR County through this company.
Kinston Community Health Center's behavioral health is here to see patients in our community that maybe to treat depression, medication assistance treatment, Suboxone, anything mental health, any mental health issues that someone may have, and we're available for them. The center started with 1 medical chair and 1 dental chair. Dr. Neuse Rose actually provided the dental care to our patients here in our community, and now we have expanded services. We have medical, we have pediatric, we have OBGYN, we also have dental, and we now have behavioral health that was opened and providing services in 2019. And one thing that is beneficial to our community is that we not only provide medical and dental and behavioral health services, we have ancillary services like our outreach department that assists with transportation. So if the patients qualify, they can get transportation to and from their appointments. We don't charge them for that. We want to make sure that we're accessible and they are able to come and get their services.
The hospital has been involved with the Kinston Community Health Center before the Kinston Community Health Center opened. We've been a partner and believed in every single thing that this clinic does in our community and for our community.
I think we have a lot of folks come from out of town, out of county to come to the facility there. So it's bringing dollars into LENOR County in our area. We're trying to keep grow together. We meet in the middle. I really don't know what folks did before the health center was there or available. I don't know. People just didn't go see the physicians or get treatment like they ought to, take care of themselves.
So it provides a service that we really didn't have before, and it is a gateway for our folks to come and receive treatment, and then the referrals to local doctors. It's really an economic engine for the medical side. It's not just about coming to the center and being part of the center. It's about coming to the center and understanding how important it is to maintain your health and how your health affects your ability to be a productive citizen, and how your health protects your ability to be a good parent.
One of the health department social workers is often stationed here to work with patients so that they can get those wraparound services where they come for point of care services. Kinston Community Health Center will refer people to WIC, which is at the health department, so that moms and babies and families have access to healthy foods. We refer clients here for any physical or mental health needs that we cannot take care of. So again, it's a partnership, it's needed.
So I do audits regularly to make sure that we are doing quality care. I check to see if charts have been documented incorrectly, if medications have been sent. I also check to make sure that we are providing the kind of care that is needed for patients who do not always have access to care.
Hello, my name is Daphne Betts-Hindy. I'm the Chief Financial Officer at Kinston Community Health Center. We are funded through various grants. Our main one are federal grants, but the largest percentage of our funds comes from providing services and billing for those services. So with the effects of the pandemic, it's always balancing what's available with what's needed.